Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic doctor here in London and welcome to my second video of Doctor Reacts to Celeb Work. Wow, you guys really liked that video that I did last week. You are some thirsty people out there. Hopefully you didn't think that I was throwing too much shade on those celebs. What I was trying to do was just keep it, very scientific. Maybe explain a little bit about why certain people end up looking in a specific way so that you can either hopefully copy that or not, depending on whether or not the outcome was good or bad. Disclosures first. So as you guys know, I do like to have the odd treatment done myself. A couple of days ago I had acrylics or Kybella on my neck and sort of along the jawline, so I am looking like a little bit puffy at the minute. If you have never seen that procedure, that's a fat loss procedure. So it's basically an injection where you, stick it wherever you have an area of fat. It breaks down the fat, so along the jawline it's quite nice to get something that's sculpted there. In America they call it Kybella. In the UK the same product is going to be called Belkyra, but it hasn't been released yet. But we have acrylics, which is the same active ingredient, and that's the one that I used. So again, I hope that I will have covered your favoured celebrity on this video. If not, again, let me know in the comment section below. I am sure that I will do another few of these videos at some point in the future, since you seem to like them. I'm going to open, first of all, with one of the most requested people. Somebody who was around an awful lot when I was a kid, and I used to think that she was like the epitome of grown-up adulthood and maturity. Meg Ryan, again another popular one from back in the 90s, definitely seeing the age of some of my subscribers here. Same issue. So she had all this product put in the cheek area. The lip, I do find quite curious about her. What is going on there? It's almost like the product has been placed a little bit too low in the lip. So there was a trend, maybe about 2 years ago, of having your lip product not put in the vermilion border, which is in the outside, but kind of underneath on the wet dry border. So that's where the inside of the mouth meets the outside of the lip. That's the wet dry border. And it was that people would kind of inject along that border here, and I used to just hate it because it kind of makes you look like you've got a curtain of upper lip, kind of like this shape, and it makes the lip longer but in this direction, downwards, so you can't see as much of the teeth when smiling. It's much more attractive if you have the product put on top of the lip here, so it kind of elevates upwards, or if you tent the lip so that, again, it elevates it upwards, makes it curl over, not drags it down like some kind of demented lion. And I don't really know what happened here. Did we all just get used to her lip looking like this, so we thought that it was normal? I don't know. That's definitely a thing, by the way, brain plasticity. So in a study where they took a bunch of pictures of women's lips and showed them to people, asked them which one looks the most attractive to you. Most people picked one which was just slightly larger than normal. And then they gave them some magazines to read, like OK, hello, that kind of thing, and asked them again which lip was the most attractive, and yeah, they all picked the one which was bigger. So there's this theory that's why you end up looking like your group of friends do, because that kind of either behavior or appearance becomes normalized to you. Okay, next up, lady who I had no idea who this was, so I had to Google her. Lisa Vanderpump. I don't know, apparently she was on some American TV show. I think for my taste, look, different sides of the pond, we like different things. For my taste, I think she's just a little bit too perfect. I'd prefer to have, you know, a bit of shine in there, maybe like show a bit of jowl or something. But this woman is literally flawless. There's not one wrinkle on her. Everything is just like tight. And I'm not saying that looks bad. It's very much personal preference. You know, even in the suburbs of London, you'll see that there are different areas which have got kind of a different thing that they like, or different thing that people request a lot. So for example, when I used to work in Essex, which if you're not from the UK, you probably will not know the stereotype of people from Essex, which is all very, you know, like white teeth, permatans, big hair, all that stuff. So many years ago, I used to work there when I first started doing aesthetics, and the requests that I used to get was always, you know, want the lips bigger, want the cheeks bigger, and there was no such thing as too much. Whereas where I am now, in Knightsbridge / Chelsea, you decide where it is, it's literally on the border, it's very much the opposite. People do not want anybody to know that they've had something done. There's kind of this interesting cachet that I was talking to one of you subscribers about, which is, do you want it to look like very natural, like literally nobody would know that you've had it done, or do you want it to kind of err on the side of maybe people knowing that you've had it done? And I think that's really personal preference. I know in some areas there's like a cachet of it looking like you've done something because it shows that you're affluent enough to be able to afford to have that procedure. And I'm not just talking about cosmetic procedures. I mean, there used to be this, I don't know if there still is, I haven't been to those areas for a long time, but there was, at least when I was there, this idea that if you had hair extensions, it was okay to wear them up, like scrape back, so that people could see the bond, so that you would be able to tell that person was wealthy enough to be able to afford to get their hair extensions done, because they're obviously quite expensive. I know in some places where orthodontics isn't free, that wearing braces, for example, can be a sign of wealth too. So I guess looking like you've had work done could be kind of good if you're into conspicuous shows of wealth. Maybe that's what's going on here with this lady who was in, what's that show? Housewives or something, or Desperate, I don't know. I don't really watch those shows, but anyway, I'm sure you guys know. So maybe that's what's going on here. You know, she looks like so perfect that it's like a reflection of how much money she has, which is kind of interesting. Don't get me wrong, if I wake up at 58 and I look like her, I'm going to be thrilled. Thrilled, I tell you. Mainly because then I can eat myself back up to my current weight. Ooh, Nicole Kidman. Again, she had this funny lip thing going on a while ago. I think it was because it was just injected a little bit too low in the lip, too close towards the wet dry border, and she got kind of this this kind of sausage effect going on there. That's gone. She probably had that dissolved. I'm saying that because often with the lip, if you do end up with like a bump at the base here, it doesn't normally go away on its own. You normally have to have that dissolved. And now she's looking very nice, very foxy. My only criticism would be the angle of the jaw, particularly in this picture that we've got here. It just seems like way too far back over there for it to be natural. So I get why they've done that. It's to kind of stretch out the jowl so that this whole thing right here is straight. So I totally get why they've done that, but it just seems a little bit too far back for me. I don't know. I think I'd rather see a jowl than have this like weirdly elongated jawline. Not sure. Oh my god, so many people named this woman Renee Zellweger. Like, do you remember when it came out in the press that she'd like debuted her new look and everybody was speculating about what she had done? Do we like it? Do we not like it? There was this huge like separation where I think literally about 50% of people were saying that they liked her new look, and 50% were saying they didn't like it, and who was this woman? Are we sure that it's Renee Zellweger? I gotta tell you, I actually quite liked it. I quite liked it. I thought before that she looked a bit mean, and afterwards she didn't look so mean. So I was a fan. And all the changes seem to be in the upper third of the face, don't they? So her eyebrows have been dropped. She doesn't have a line or a wrinkle on her forehead, but the actual the size of the eye, so the upper eyelid, looks like some of the skin there has been removed, and it's really opened her eyes up, which has given her a completely different look, but one which I think is quite nice. I mean, I'm just looking at these pictures right now on this laptop, and I'm thinking, God, she actually looked, you know, like, well, I said mean. I could probably go a bit further than that before. But everything else still looks pretty similar. So the mouth is kind of the same. The jawline, in fact, is probably even a bit softer after she's had the treatments done. Cheeks, okay, not exactly the same, but if anything, I'd argue that it's not quite as cutting as they were before. All the work has sort of, well, obviously not all the work. What I mean is all the obvious work is up here in the forehead. Crazy how those little tweaks, though, can completely change the way that a person looks. Would she have got her acting roles if she'd looked like this from the get-go, you know, but a younger version? I don't know. Okay, back to the UK now. We've got Talisa. She was in some band a few years ago. She had some stuff done. I think the press caught her on a bad day. I don't quite know what was going on there. I think she was going to court or something. And maybe she just had it done, so it was all looking kind of stiff. Or, I don't know, maybe it was just like loads of filler were put in. But she really got taken to town for that one. It's all the lip, isn't it? So, there was a paper published in, I think it was 2014, don't quote me on that one, but I think it was around then, showing that in a slightly older age group, so 40 plus, you could increase the vertical height of the lip by about 2 millimeters before those people start to say that it looked weird. And in a slightly younger age group, so 17 to 40, you could increase it by 3 millimeters before that group of people said that it looked weird. This was a computer generated image, by the way. I think it's fair to say that our Talisa here has probably increased it by, what, like 5-6 millimeters? So even like the millennials are not going to say that this looks normal. What's younger than a millennial? I don't know. I'm going to Google that. Oh, Generation Z. So God knows what they would make of it. But yeah, they'd probably say that it doesn't look natural either. Next up, we've got the lady of fashion and pop herself, Victoria Beckham. I love your clothes, by the way. I think they're fantastic. Very well cut, very well tailored. Wish I could dress in them all the time. I think she's looking excellent. Her face shape hasn't really been changed through the years. So there's some very, very good restoration work going on here. Very much like Jennifer Lopez as well. I really like how she's kind of developed this slightly more natural look over the years too. So remember, she got her breast implants removed too. She's certainly keeping her skin in very, very good condition. So it's just glowing. I guess the only giveaway for me would probably be the eyebrow. So you can see the tail of the brow just starting to drag a little bit there. I don't know if it's just this picture. I literally haven't spent hours trawling the internet looking for pictures of celebrities. I do have better things to do with my time, although it probably doesn't seem like it. I think there's probably a bit of lip augmentation going on there as well, which is fair enough. I think they look very nice. Nothing has been overdone. altogether, I think that's a very positive result. Last but not least, I think this woman is just like the epitome of fabulousness. She does not care what anybody else thinks about her. She's just like, yeah, you know, I'm Donatella Versace. I want to have my hair like platinum blonde down to my backside, poker straight at my age. No problem, go for it. I want to like overline my eyes with this ridiculously dark eyeliner so it just looks like they're like gaping black holes in my skull. Whatever, go for it. I want to not have any eyebrows. Fine, you do you. You really do have to respect somebody, I think, who just does not care about your opinion. I think it's amazing. I love the way she dresses, by the way. In terms of her aesthetic treatments, I mean, you know, Donatella's a woman who's looked after herself, or tried to. She's probably been out in the sun a bit too much, suffering some sun damage there. Same issue as a lot of the previous people that I've spoken about, with that whole wet dry border of the lip thing, and then the product being sort of on the underside of the lip instead. Maybe she's had lip implants, maybe they all have had lip implants, I don't know. That's certainly a harder problem to fix than if you put hyaluronic acid in there. She looks like she's got a bit of nasal collapse as well. Not sure what that's from. You know, hell. Who am I kidding? I would definitely live her lifestyle if I was Donatella Versace. Not sure about the crowns though. They're either like crowns, veneers, I'm not sure. I've been out of the dentistry game for a while, but what I can tell you is that is definitely not her teeth. So basically I want to look like a combination of Lisa Vanderpump and Donatella Versace wearing Victoria Beckham's clothes when I grow up. That would be nice. Okay, thank you, please. Okay guys, that's it for this week. I hope you enjoyed the video. Probably back to the normal programming next week where I'm talking about aesthetic treatments. If you enjoyed this format, then let me know in the comment section below, because I'll probably do another video like this. There are quite a lot of celebrities and people that you've mentioned in the comment section from last week's video, which I haven't really touched on. So if you like it, let me know, tell me. Smash the like button, ring the bell, click on the subscribe. I don't know, I've run out of words to use there. Okay, so I'll see you guys again next week.